Welcome, Casey. How are you doing? So I'd really love to just learn a little bit more about you, for our audience. Hubbly is the startup you're working on. If you could tell us the journey of getting there.
I started Hubbly Surgical alongside a team of students at Northwestern. I was in this class. It was a cross-listed business school, med school, engineering, law school class called Invention Medical. It's at Northwestern. And the whole purpose of the class was to teach you by doing how to start a fledgling medical technology startup. And I teamed up with some students, one who was a neurosurgeon, another guy who was a electrical engineer who is now a law student. Together, we came up with this idea of a cranial drill that stops automatically. And the reason that's important is because the neurosurgeon on the team, he was a neurosurgeon getting his MBA at night. He was the one who said that he uses a hand crank drill to drill holes into patients' skulls every single day. And this is the most common neurosurgical procedure. It's an emergency, so it's done in the ICU typically. This neurosurgeon, Dr. Ahmed Ayer, said, he uses a hand crank drill every single day. And he said, basically he was like, there's got to be a better way. And we came up with a drill that's battery powered and stops automatically when it breaks the skull.
Sounds like you worked with a lot of professionals while you're an undergrad student at Northwestern. How did you get them to take you serious? Not to say in an insulting manner, but you are an undergrad and they are someone with an MD.
No offense taken. In all honesty, when I first started the class, I was really worried about my ability to team up with people because I was the only undergrad in the class. The class actually was not for undergrads. So I was way less qualified than pretty much everyone else in the class. So I, went to the front of the class at the beginning of a couple of lectures and said, hey, if anyone wants to work with me, here's some ideas that I have. And they were all neurotech related. After one of these idea pitching sessions, Amit, the neurosurgeon, came up to me and said, hey, I like your ideas. I'm a neurosurgeon. You seem to be interested in that. So let's work together.
So it was really just your passion for neurosurgery, which convinced him to work with you.
Pretty much, yep.
So is he still on your team today?
Still work with him. And he's immensely helpful, obviously, providing that expertise.
You start with this class project. You eventually, you get to this drill idea. But then how do you make that reality?
You don't need to decide to go full-time right away. But at the very beginning, when we graduated from the class, it was a matter of talking to the professors and they said, hey, I think that you're actually onto something here. The immediate next step is to file a patent and start trying to get some money. So we did that. We filed our first provisional patent in November of 2018. So about 6 months after we had finished the course. Right when we filed that first patent, we felt that our IP was protected enough to start writing grant applications and applying to pitch competitions. Won some early funding, which paid for that patent prosecution and then allowed us to incorporate as a company. And then I would say that the biggest leap of faith was right after that period. Now the next step was, if we're actually going to do this, we're going to need some significant money in order to actually build the product and then do FDA testing. That's going to take, at least $1 million upwards to get that FDA clearance. The only ways to get that kind of money are either through government grants like NIH or NSF grants, or through investment. The only way to get investor funding is if you have a full-time CEO. That was the period where I graduated in June of 2019, worked full-time as a software engineer for about 6 months. And in that 6-month period, I applied for startup accelerators, which we got into an accelerator called Alchemist in the Bay Area. And I quit my job on December 3rd, 2019, moved to San Francisco on December 4th of 2019, and then the accelerator started on December 5th.
So a few follow-up questions with that. One, like you said, your IP was protected because you had this provisional patent. But were you ever worried about another competitor, doing something completely different, solving the exact issue and beating you to market?
I know, it's a good question. It didn't really worry me because I guess I figured it was something that I had no control over. I was constantly attending these conferences, talking to some strategics, some of the big players in the space, and getting kind of that positive reinforcement that we were working on a real need and what we were doing was important. And so I figured that we were doing the diligence that we had available to us to see what else is out there, who else is working on this. And if something came up out of nowhere, then, all we can do is work faster. And saying I should go full time on this company as soon as I can, instead of working as a software engineer for 2 years first to save up money.
Yeah. So talking about that, you did end up taking a job. You had some sort of safety net. You didn't want to go all in right away. What was your rationale for that?
Actually, I got offered the job like a year in advance. It was before we had filed our first patent. It was before we even really started applying for pitch competitions. So I accepted the job in, I guess, September, October, whenever I got the offer. And as the company started to become more and more legitimate and it looked like something that could be something, I did have that decision to make when I graduated in June of do I just go straight into it or should I do this job? The nice part of working a full-time job for like 6 months is that I had enough savings that I said, okay, I can go full-time on this company for like at least 3 months and totally pay for myself and not need any other funding.
Take me through those 6 months though, when you're at your job. How are you still trying to manage a startup, which at the time I believe was just you and Amit?
Yeah, so it was nice. I had permission from my job to like have this as a side hustle. I was working for a bank as a software engineer. So like a medical device cranial drill was like way out of the realm of what I was working on there. I mean, it was just nights and weekends. It was kind of all I worked on in my free time. And it just got to the point where, by the time I applied to startup accelerators in like maybe like September, October, like only like a 4-ish months into my job, I felt like I absolutely had more than 40 hours per week of work that I could be doing on my startup. You know what I mean? Like I was like, I know exactly how I would be spending my time every day if I went full time. And that was part of the signal to me where I said, okay, it makes sense to go full time on this. I know what I need to do, how I would structure my day. There are things that I don't have time to do right now because of my job. So it kind of like built up in the beginning. I would say I was working on it maybe like, I don't know, maybe like 20 hours a week right when I graduated. And it just like steadily got there more and more work came up. Like my to-do list just lengthened.
What did you wish you could do, but you couldn't because of your job?
Definitely a lot of product development, the iterative process of testing in the workshop and then trying again, 3D printing new things, and then being able to pull the new 3D prints right out of the printer instead of like if 3D printer becomes ready in the middle of the day when I'm at my job, that I have to wait until night to get it. That kind of thing was definitely very time consuming, or rather it was also definitely was taking calls. I wanted to chat with as many neurosurgeon users as possible to get their feedback on what I was working on, and then also to have them in person try out the product. And since I was constrained on kind of this 9 to 5, it was like I was also very I was constrained not only by these people's schedules, like neurosurgeon schedules, which are insane, but then on top of that by my own schedule.
So when you leave to go to this accelerator, it lasts for, I'm assuming 3 months, like most accelerators. How did you leverage the extra funding you got, and how much runway did that give you?
Well, it ended up being a lot of runway because we made it last. So the accelerator was supposed to be from December to May. So December 2019 and May of 2020. But then in mid-March, it went completely virtual. And I had been planning to raise our first capital round in May of 2020 at the end of the accelerator. So when the world kind of shut down in mid-March for the pandemic, I decided to delay that fundraise until the end of the year. We did manage to raise a very small, like I want to say $300,000, like I'll call it a friends and family round, because it was primarily like individual angels, people in the network. So that was really helpful. So I guess the $330,000 basically ended up lasting us like a year.
When you go into this angel round, a lot of people are always like, oh, I reached into my network, I reached into angels. But really take me through that, because early on, these people are giving you money when you essentially don't even have like a real product or anything yet. What is like your mindset going into those conversations? Do you feel an additive pressure, especially if it is friends and family rather than a venture capitalist or someone?
That first round that you raise is the hardest. Everyone probably tells you that, but like the first $1 million that we raised is genuinely by far the hardest money that we've ever raised. Every round since then has been like a walk in the park in comparison. But yeah, it's really hard because at the beginning, you're right, you're just selling people on an idea and your passion. In general, you don't want to take money from anyone who the relationship would be ruined if everything goes bottoms up. That's where the accelerator comes in, where through the accelerator, you're working with people as mentors really closely for like this 3 to 6 month period. And so the kind of idea is that they're getting to know you really, really well. And so that's why they can say, hey, I've worked with her for X number of months and I believe in her passion. I believe that she has the grit and know-how, whatever else that she needs to get this venture done.
So when you're raising so early, I know, angels tend to take more equity. How do you weigh that against trying to bootstrap? In your case, it's probably very, very hard to bootstrap a medical device, but at the same time, you can be giving your company way in some regards for what is going to be your lowest valuation.
I feel that we bootstrapped as much as we possibly could have. And again, I feel like we bootstrapped from the time that we took the class. The class started in September of 2017 until like early 2021 when we started raising significant money. And what I mean by that is like everything that we could possibly do on our own or like do cheaply when it comes to like customer discovery. I have this one example where there was a neurosurgery conference in Phoenix. I really wanted to go, but I did not I didn't want to spend the money, or I didn't have the money to like pay for the conference attending fee or for the hotel. So I bought flights, and my best friend from high school's grandma lived in Phoenix. So I stayed with her. I'd never met her before, but I was like, hey, friend, can I stay with your grandma? And they were like, sure. So I stayed with this grandma and I attended the whole conference. That conference, I just went up to a ton of, I went to all these different sessions of people who I wanted to talk to. And I would like run up to them after their panel or whatever. And I would say, hi, I'm Casey. I'm working on this thing. I'd love your input, whatever. And I ended up getting like maybe like 30, like 15-minute conversations out of this conference. And
that's a lot of grit, especially for being by yourself doing this user research and you only have one co-founder. At what point did you bring on someone else to the team?
My CTO, Tyler, joined on March 1st, 2020. And he basically worked like half-time for almost a year, maybe like, until 2021, where he quit his full-time job. But then we didn't have the money to pay. I mean, I wasn't making a salary. I didn't have the money to pay him.
Where'd you meet Tyler? Because nowadays, what's in supply is ideas. What's not in supply is a CTO.
I actually met him through the very small world that is Chicagoland MedTech. But my professor of the class that this company was founded out of, his name is Mark Fisher, and he's a medical device engineer. He was like the engineering professor for the class, but he's primarily an engineer. I think what happened, so I put up a LinkedIn post, which is a crazy thing to do for a co-founder, like a LinkedIn job application. And Tyler, I know a lot of people applied for it. He was flagged as someone who people really liked working with and who had the perfect background.
It seems that early on you had a lot of doctors on board, but you obviously still have to go through like the whole FDA testing approval process. So how do you really maintain faith and conviction that it will pass? So because one failure could derail your whole startup, what you're working towards. Even if you have doctors on board who say, I love this, they're still not the people that are signing off that they can use.
Of course, I mean, the FDA clearance is the name of the game. So my head of quality, Julie Byers, is amazing. So I totally credit basically the whole FDA clearance to her. It's definitely a very long process. That's why it takes so much time to make sure that every step of the manufacturing process and then of the obviously of the actual like device like testing works. But yeah, I guess I don't necessarily think of it as, it could have been one thing and then we failed. It would have been like if we didn't pass any given test during the testing, then we would have gone back and made the right changes and then tested again. Once you pass all the testing, then you go to the FDA and then you just sit back and wait and see if they ask for more testing. And again, if they do ask for more testing, you just go back, you do the testing, you pass and then you keep going. And again, it's like, if you don't pass, then it's a thank God they asked for the testing because you want to make sure you're putting out a product that has no safety or quality issues out in the field.
You've been going at this startup since 2018. So what I want to know is really, what were your lowest moments? It's a tumultuous process and you will have a lot of low points. So kind of what were your lowest points in this 6-year, 5.5-year process?
The lowest point was fall of 2020, which as I mentioned earlier, we had originally planned to raise our round in May of 2020. And then I postponed it to like September, October. So I postponed the raise to September because I figured like 6 months after everything shut down because of COVID, like maybe people would, the market started to bounce back a little bit and investors were a little less afraid of doing some risky investments. So yeah, when I tried to raise again in September of 2020, I always say this, but I had I had exactly 50 investor meetings scheduled. And it was like, I had gotten these meetings primarily from Alchemist, from my accelerator. And it was like through this network that I had scheduled 50 meetings. And investor number 3 said yes. Investor number 6 said yes, and then I got 44 no's in a row. And at that point, I had just like run out of people to have meetings with. Typically, if you get more yeses than that, the people who say yes introduce you to their networks, and then you get more investors, and that's how it can grow beyond the 50. But in this case, since I had gotten a total of 48 no's, totally exhausted my network. So, and it wasn't growing. So that was rough because that was right around when, I had been telling my CTO, Tyler, that we were going to hire him full time as soon as we'd raise this round. And then I just totally failed to raise the rounds, and it sucked. And I get at this point, it was like, I wasn't making any money. I didn't have money to pay Tyler. We had been surviving off of like really tiny grants that I got here and there, like little pitch competitions and stuff like that. So, I went back to the 48 people who said no, and I asked them, why did they say no? And I think it's important to note that when they first said no, I asked them, and they all said, you're too early, it's too risky, COVID, whatever. And I went back to them after I had exhausted my network and was like, shoot, what do I do? I went back to them and I said, okay, now I need to actually give me a reason that I can control, not just I'm too early or it's COVID, but is there, clearly you might have invested. That's why you took the initial meeting with me. What can I do? What could I have done? What can be different about the company beyond just we're too early that would make this a compelling investment for you? And I got really great advice, which was that our cost of goods to make our product was too high. They said, I think your COGS are too high in this pandemic market. Healthcare costs need to be low. Hospitals are having trouble with their budgets, and you cannot be raising the price. Like, your COGS are too high. It means your price is going to be too high. It means you're not going to be able to sell. And so I took that advice to heart, and Tyler, my CTO, and I, but probably mostly him, really just completely like reinvented the Hubley drill. Like, we had built the drill, we had our MVP, and we went back to the drawing board and said, we need to reinvent this so that it's cheaper to make, or less expensive to make. And he did. And it took him, he was like a powerhouse. It took him like 2 months. And then I went back to those investors and I said, hey, I listened to you. I took your advice. Here's our new COGS and here's what our new price point can be. And then a bunch of them invested. It worked.
So when you were at your low point, did you consider just walking away, maybe going back to your previous job? Or was it always, I'm never going to give up? I mean, you basically exhausted all options. So why didn't you walk away?
I never considered walking away because I'd already taken that $300,000 of angel funding. And so I knew that I needed to bite to the nail to make this company happen. And I still genuinely was very, very passionate, and still am, about the actual mission of the company, which is patient safety. So I think that that's kind of what it boils down to. And that's why those angels early on are investing in a passionate founder, because you have to be actually passionate about the mission to not walk away when it gets hard. So those were the two things. But no, I never considered walking away because I feel like there's always more options. There's more options because I didn't have actual employees yet. So I didn't need to pay myself. I could just couch surf. My CTO, I felt really sorry for him, obviously, that I kept telling him that, oh, we're going to race this round, I'm going to hire you full time, it's going to be great. But he also didn't walk away because he also had faith in the mission and faith in both of our abilities to figure it out. But anyway, so we didn't have like a payroll that we were missing. It was just the two founders who know that they're taking on this risk when they found a company. So that made it easier, I think, to just say, okay, we have no money, or, we have like $10,000 in the bank or whatever it was. I don't remember. In all honesty, I don't remember exactly how low our bank account got, but however much money we had, it was like, this is what we have to spend on product development. And that's going to be the most important thing, is making as much progress as possible. It would have taken many more grant rejections and investor rejections before I would have considered giving up.
So now that you just recently raised $3 million, and throughout this whole process, has the vision changed at all, or like your approach?
I think that really the only change is that in the very, very beginning, when this was a class project, and probably, again, those early days when I was first starting out, first going full time, I was really focused on this one procedure with the hand crank drill. And I realized after that, or we as a team realized, and customers, like users have helped us realize too, all of the other possibilities for this technology. So the vision has definitely expanded and continues to expand over time as we ourselves think of new avenues for using the technology. So again, we're an auto stop and drill, so it's a matter of thinking of what other medical procedures would benefit from an auto stop. And as I said, a lot of times, like now that we're FDA cleared, we have paying customers, our customers will come to us and say, hey, I think it'd be really useful to have this in XYZ procedure. And then we're like, that's great. Let's talk more about it and see how we can make that happen and what the regulatory process is for that. So the vision has expanded from being pretty laser focused to making medical drilling safe across a whole bunch of settings and across a whole bunch of procedures. And we're starting off with the hand frame drill.
Well, I'm glad the vision has expanded. I can definitely see it. There's definitely value in all sorts of procedures. But I want to ask you just one final question that I ask every interview. And has there been any routine that you've kept throughout the years?
The one thing that I've done to keep myself sane is, this is super nerdy, but I have actually been doing a part-time, one class at a time, nights and weekends, master's in applied math for like the last 3 years. So as I said, it's one class at a time, and it's totally virtual, like nights and weekends. But I'm actually almost done with it. I've done it for over 3 years now, and this semester is my final class, and I don't know what I'm going to do with myself after. But it's been really nice because doing math proofs is not a part of my brain that I am ever using with respect to my company. I have to use my brain all the time, and I feel very intellectually challenged and fulfilled. But like math proofs specifically is not part of it. So it's kind of fun to just like be able to like sign off my emails at one point in the night and say, I'm just going to do my math homework now. As I said, super nerdy, but it's something that I really liked doing. And I'm actually doing that part-time math master's with my dad, and we don't live in the same state, but he and I have taken a lot of like classes at the same time, which is kind of fun. We can like work on our homework together and stuff. And
well, I would definitely call it a routine. Thank you so much. And with that, this has been Uninvested. I'm Sahil.
I'm Casey Qadir.
And this is Uninvested. Thank you. This is a personal video. Any views or opinions represented in this video are personal and do not represent those of people, institutions, or organizations we may or may not be associated with in a professional or personal capacity.
The views expressed are for entertainment purposes only and not to be misinterpreted as actionable investment advice.